Good morning, afternoon to all present. Within today's presentation, Rachel, Laura and myself are going to focus on the topic cancer control, focusing on both lung and breast cancer specifically within both adolescents and adults. The Cancer Council 2014 states that cancer is a destructive disease that attacks the body's cells, organs and tissues, the basic building blocks of human life. While the National Cancer Institute describes cancer as a disease in which abnormal cells divide out of control with the ability to invade other tissues, cancer cells have the ability to spread rapidly within our body through blood and lymph systems. Cancer is not a singular disease, but instead many diseases, with there being more than 100 cancers. Cancer is frequently named for the organ type or cell in which it begins. For example, cancer that begins in the breast is known as breast cancer. Within the presentation, we are going to touch base on the following aspects of cancer control within both adolescents and adults. Firstly, prevalence, then risks and causes, prevention strategies, and then management strategies, followed by a conclusion. The purpose of this presentation is to give society a general overview of the main aspects and ideas related to cancer within both adolescents and adults, allowing them to gain a greater understanding of the disease and how best to prevent and manage it. I'll now pass you on to Rachel to cover prevalence.
Within the prevalence section, we are going to focus on the statistics on both adolescents and adults in relation to the breast and lung cancer, specifically with statistics. I'm also focusing on cancers in general. Statistics from Australia, US and the world will be explored. So in Australia in 2007, 774,674 people were diagnosed with cancer. That was 4% of the population that were diagnosed that year. In the same year, 381,164 men were diagnosed within the last 28 years, as opposed to 393,510 females. 1 in 3 females are diagnosed before 85, as opposed to 1 in 2 males diagnosed before 85. Between 1983 and 1996, cancer in teenagers and young adults increased by 1.5% per year. $15 million has been put towards Teen Cancer Network programs, and 2 Aboriginals and Torres Strait Islanders are diagnosed with cancer every day. Within the world, in 2012, there were 14.1 million adults diagnosed with cancer. Of this number, 8.2 million of these people died. 2 in every 3 people are diagnosed with cancer. The socio-cultural aspect we looked at was the US. This figure shows that the cases of cancer in the US and the deaths from cancer. In the US, deaths account for 3% of the diagnosed cancers, as opposed to the previous worldwide statistic of 37%. 13,000 children and young adults are diagnosed before the age of 20 each year in the US. This is the same amount of people you can fit into the Greenwich Center. In relation to this figure, we can see the amount of individuals that survive a variation of cancers within the US. This shows statistics by number, while other studies in Australia show a percentage of both female and male individuals that survive lung and breast cancer within a 5-year bracket. Statistics show that 87.8% of individuals survive for 5 years with breast cancer, while 11.8% of individuals survive up to 5 years with lung cancer, and this is a statistic by the Cancer Council.
Okay, so now looking at the causes and risk factors of cancer, lung and breast cancer specifically. Cancer Australia states that there are a vast majority of risk factors related to both breast and lung cancer, with some that can be modified while others that cannot. It is important to note that just because we have 1 or even 2 risk factors, this does not automatically mean that we are going to develop cancer. Firstly, looking at breast cancer. The Cancer Council 2013 states that the exact cause of breast cancer is not yet fully understood, although some factors that are shown to increase the risk include aging, past experience of breast cancer, close relatives that have been diagnosed with breast cancer, certain conditions such as atypical ductal hyperplasia. Alongside the above risk factors, there are also risk factors that are specifically related to men, with men more likely to develop cancer over the age of 60. The most common risk factors to date include close family members who have been diagnosed with cancer, relatives who have been diagnosed with breast cancer prior to the age of 40, relatives that have been diagnosed with cancer of the ovary or colon, and a rare genetic syndrome known as Klinefelter syndrome. Now moving on to lung cancer. Lung cancer is much like breast cancer as the cause of it is not yet fully understood, although there are a lot of research that shows a number of factors that are highly associated with the risk of developing the disease. These include tobacco smoking, environmental factors such as asbestos, diesel exhaust, radon exposure, air pollution, age, family history, previous lung diseases such as lung fibrosis or chronic bronchitis, and past cancer treatments. Okay, does physical activity, nutrition, or mental health relate to the cause of cancer? So firstly, if we take a look at physical activity and breast cancer, the link between breast cancer and physical activity has been studied over time very broadly, with literature by the National Cancer Institute 2009 stating that physically active women have a lower risk of developing cancer than that of women who are physically inactive. The amount of risk reduction varies between 20 to 80% depending on the person, with studies also showing that BMI levels have an impact on the effect of physical activity, with the largest benefit found in women that fall within the normal rate range, with this being a BMI less than 25 kilos per metre squared. Studies also state that the risk of breast cancer decreases as the duration and frequency of physical activity increases. Studies also show a link between physical activity and the risk of lung cancer. Studies state that there have been 21 studies done that have examined the impact physical activity has on the risk of lung cancer. These studies have found that the most physically active individuals experience approximately a 20% reduction in the risk of lung cancer. Nutrition is another aspect of our health that is shown to be linked with the risk of cancer. Studies by the Cancer Nutrition Center 2012 show at least 35% of all cancers have a connection with nutrition. On top of these figures, they also state that when lifestyle factors such as smoking and exercise are incorporated, then the affiliated risks become much stronger and can increase to as high as 85%. While psychological stress has not been found to cause cancer directly, studies by the National Cancer Council 2012 have proven that stress that lasts for a prolonged period of time can affect an individual's overall health and ability to cope with cancer. While studies also show that individuals who are better able to cope with stress are found to have had a better quality of life while they are in the process of being treated, while this does not increase their survival period. Lastly, in what ways are adolescents vulnerable to cancer? Studies show a vast amount of reasons as to how adolescents are vulnerable to both lung and breast cancer. Some of these include, but are not limited to, firstly, cosmetics. A study by the Breast Cancer Fund 2005 found that adolescents were unaware of the ingredients within cosmetics they were using, with these cosmetics found to be linked to breast cancer. Secondly, overweight. Studies by LifeRight 2013 show that adolescents that are overweight are vulnerable to a variety of cancers. That's the end of the cause and risks factors section. I will now pass you on to Laura to talk to you more about prevention strategies in regards to cancer.
According to a report from the Cancer Council New South Wales, in 2007, there were 20,104 observed deaths, having lung and breast cancer being the most common. Tamoxifen is one example of a chemoprevention treatment for breast cancer, especially for people with a family history of breast cancer. As found through the randomised placebo-controlled breast cancer prevention trial, tamoxifen reduces the risk of estrogen receptor-positive breast cancer. Chia and Wolf 2011 found that it is highly effective for premenopausal and perimenopausal women. The prevention strategies for lung cancer are largely focused on getting individuals to stop smoking or smoke less, as seen in the comprehensive control programs aiming to reduce tobacco use, associated diseases, disability, economic cost and death, through a variety of evidence-based strategies. Graf and Weasley 2010 suggests that doing physical activity can reduce the risk of breast cancer by 22%, where a body mass index of less than 22 kilograms per metre squared can provide further reductions, allowing the incidence of breast cancer to be dramatically reduced. Lung cancer can be potentially decreased through occupational physical activity, which is mentioned by Polari et al. 2013, increases cardiopulmonary function and perfusion and allows immune function to be improved. Using this prevention measure, there have been more males than females who have received their risk of getting lung cancer. Nutrition is also a preventative measure, decreasing the risk of getting lung cancer. Having a high consumption of fruit and vegetables being a primary elements of prevention. Researchers found that a variety of vitamins are also beneficial in reducing lung cancer risks. If an individual were to combine both these preventive measures, it would enable them to have a further reduction of getting lung cancer.
I will be discussing behaviour modification techniques that can reduce or manage the prevalence of breast and lung cancer, and behaviour modification techniques related to physical activity, nutrition and mental health. The American Cancer Society state that more than half of cancer deaths could be prevented by making healthy choices like not smoking, staying a healthy weight, eating right, keeping active and getting recommended screen tests. This is one way to reduce and manage the prevalence of cancer. This relates to both the prevention of cancer but also the management of cancer control. One strategy of managing is how to tell others that you have cancer. The Cancer Council 2014 has different suggestions on how to break the news. They recommend telling others when you are ready, ask for help from both family and friends, and be prepared for questions. They also suggest talking to the doctor about any concerns and finding information so that you are prepared and understand what might or will be happening. Joining a support group can also be very beneficial in managing cancer, as research has shown that people who take part in support groups have lower levels of anxieties and depression than those who don't. Nutrition is something that is crucial to cancer patients and their management of this disease. Nutrition and eating healthy diets helps the body cope with the treatment and recovery. On the American Cancer Society website, under their Staying Healthy section, they have a whole range of guidelines and recipes relating to nutrition specific to prevention and coping with cancer. This is a great tool for both families and those who are diagnosed to manage the disease. Included in the same section under the American Cancer Society website, there is also information relating to physical activity, again prevention and coping with cancer strategies, and fitness guidelines. Exercise has proven to help with breast cancer as it decreases the amount of exposure with breast tissue to the circulating estrogen. Exercise also helps with fatigue from the treatment. The American Cancer Society doesn't just have exercise plans for all general cancers, but they also have information about breast cancer surgery and physical exercise for after that. They have exercises from 3 to 7 days after surgery and onwards till a regular exercise plan is put into place. They have both descriptions and pictures to show the movement and how it is performed properly. Managing cancer control includes a range of techniques relating to reducing and managing prevalence, mental health, nutrition and physical health, which are all important in the road of recovering and managing cancer.
In conclusion, it was through detailed research that we acknowledged that there are a variety of aspects that contribute to cancer control, including things such as, but not limited to, causes/risk factors, prevention strategies and management strategies. In summary, Cancer Council and American Cancer Society are two of the major organisations that contributed to this presentation.